October is Breast Cancer Awareness Month, so we brought in Professor and Chair for the Department of Pathology and Laboratory Medicine at University of Florida College of Medicine, Dr. Shala Massoud, to tell us what everyone should know about breast cancer. Doctor, thank you so very much for joining us today. So what is the significance of October as the Breast Cancer Awareness Month?
Well, first of all, thank you very much for the opportunity. I would love to talk to the public about breast cancer at any time. And October, that the whole world really turns pink, is practically a celebration of the survivors. I mean, we are very, very delighted that as time goes on and we are doing better, the number of breast cancer survivors are increasing across the world. And we want to celebrate them, we want to congratulate them.
Doctor, what's the impact of mammography in early breast cancer detection?
Well, the significance of early breast cancer detection is the sooner that we would be able to identify abnormality that relates to the breast cancer, the sooner that we can manage that patient. Therefore, when we do a screening mammography or the patients themselves, they find an abnormality in their breast, often these patients are the one that their breast cancers are earlier stage, they're smaller, therefore they are manageable. And in that setting, this is where the emphasis on two different components of breast care is something that we need to keep in mind. One is to advise people to really exercise what I call it self-breast awareness, meaning that we need to know how our breasts look like so that if there are any changes in the skin, if there is a mass, if there is nipple discharge, if there is pain occasionally, all of these symptoms relate to the fact that maybe this is time for that individual to go to a physician and make sure that they are being examined and they undergo a variety of different breast imaging, ultrasound, mammography, so that we will be able to see if there is anything that needs to be sampled and is there anything that we need to do to make sure that the patient is properly diagnosed and properly managed.
What are the most important changes in breast cancer diagnosis and therapy?
Well, it really depends on the stage of the case. When you are doing a screening mammography, the changes that occurs in screening mammography are the one that lead to the decision of doing breast biopsy and then find out what the breast abnormality is all about, because majority of the things that we detect by mammography, they're benign, and there are a small portion of them that they are malignant. But collectively, as far as the person itself is concerned, if there is any time that a woman detects a mass, no matter how small and how large it is, that is the time that they need to really refer to a physician so that they would be able to sample the mass and find out whether the patient has cancer or not.
Hey, doctor, you told me off camera that you guys have a forum coming up. Can you tell us a little bit about that?
I can invite the people in the community of Jacksonville and anywhere else to come to our public forum, which is a dinner session that I have a multidisciplinary group of physicians that they are going to be there to respond to the questions of the public. There is no fee associated with participation. The dinner is served. And at the same time, this is something that they're going to really learn the most recent discoveries and progress that we have made in breast cancer. So this is a public education for people to know what breast cancer is and how they need to really, position themselves in relation to when they hear that they have breast cancer. So this is an invitation that is at Omni Hotel. They can call my office 904-244-4387 and get some information and reserve the seat to join us on October the 3rd at Omni Hotel.
Excellent. Doctor, thank you so very much for your time this morning. We really do appreciate it. And guys, if you want to catch segments like this, head over to FCN Plus.